Hello, everyone. A very warm welcome to another exciting episode of Psychology Talks. This is the fourth episode, and I'm so excited that the way I'm doing one after another, it's enlightening for me and for the people as well. So, as my mission continue about spreading the knowledge of psychology, I chose this very important topic today is how to deal with depression. As like many a times meet with a lot of people who are suffering, silently suffering from depression. it's it is actually considered a silent killer because a lot of people don't know what they've been suffering to and how much damage it can do to their lives and to their loved one. According to World Health Organization, more than 264 million people of all ages suffer from depression globally. So today's guest is Dr. Hardik Joshi. I invited him because he is the survivor of depression and he's on the same mission of creating awareness about mental health. He is the best selling author, international speaker, and coach. He has published two books: How to Develop a Never Give Up Attitude and How to Be a Loser. His books sold more than 13,700 copies globally in like more than 100 countries. And he's got the rating of like more than 700 plus ratings with the average of 4.5 on Amazon, Goodreads, Flipkarts, and on other portals. He is the founder of Thumbs Up Foundation. He has the prime purpose of this foundation is to spread awareness about mental health across the globe. And till now, more than 20,000 people from 100 plus countries are connected with this mission. So let's welcome Dr. Hardik Joshi. Hello, welcome
Hello.
to Psychology Talks. How are you?
Thank, thank you so much. I am fantastic. And first of all, I would express my sincere gratitude uh,
Thank you.
to you and the viewers.
Yeah, who joined us today. And it's a pleasure to have you today with us. And as I told in the beginning, that it's since you have gone through depression, so I feel that you can guide our audience much better way, and because you know how it feels like. So just tell us about your journey. That how you actually went through all the depressive episode and how you dealt with it and how you came up with the Mission Thumbs Up program.
Yes, I still remember those days, and it was very, like painful experience. And I always say that depression is a kind of devil or demon, and we need to fight strongly. And that it's like that demon is living inside us. So if something or someone is outside and we need to fight, it's easy in
Yeah,
comparison with what is within us,
yeah,
right?
yeah.
So of course it is difficult, but not impossible to overcome this
Yeah,
kind of phase.
yeah.
I vividly remember that when I was in 12th science, 11th, 12th science,
Mm-hmm.
I was a studious kind of person. And maybe because of my own expectations of doing well in studies,
Yeah,
along with the OCD, that obsessive
yeah.
compulsive disorder,
Mm.
made me to sink into depression.
Ah, yeah.
So, but yes, I mean, at that time I was not knowing that what exactly was going with me,
Mm-hmm.
uh, but it slowly increased, and it reaches to the point when I was in third year of chemistry, BSc chemistry.
Mm-hmm.
At that time, I realized that now I cannot focus on any particular task.
Mm-hmm.
So, like depression is a kind of disease, we can say that, or illness
Mm.
that that causes paralysis to our
True.
mindset, and
Very
that paralysis, that paralysis of mind turns into like physical paralysis,
yeah.
because we don't feel to do anything, right?
Absolutely.
We
Yeah.
even find it difficult to carry out our day-to-day activities. So yes, I mean, as I said, like in 2007, I talked to my father for the very first time. I tried by myself to overcome it, but I could not do it for a longer period of time. And there was a time where, like, it's like,
Yeah, you can't
boss,
do
this
anything
is
else.
this
Yeah.
is
Enough.
it.
Yeah.
Yes, enough is enough. I don't know exactly what is going on, and now I need to tell my parents that
Okay.
yes, I am suffering from something. I don't
Yeah.
know what
Yeah.
exactly it is. Yes,
Okay.
so
Yeah.
it was difficult.
Yeah, yeah, I know. Actually, that's the main problem because of this, with psychological disorder, especially like depression or something. People go through it and they don't know what is happening to them, or they don't know that is it something to be taken care of. So,
Yes.
this is very important. Let's look at our audience that who has joined, who is saying hi to us. Like, let's see, Ahmed Khalid is saying, "Good to see you, Ahmed." Sanity, I believe, is like saying, "Good day to all." Tajveer is great. Hi, Krista. Good to have you. Metin Gosser is there. Sanity is saying, "Salam, salam." Okay, Amjad, hi. Hi, good to see you all. I mean, here, Noor, Saad, Sanity, like Falgun is also there. Good to see you all. It's so nice to see all the great faces who we see actually on the LinkedIn and interact with them. Ligia is also there, and she's hello, Ligia. Uh, and then any is like, is depression good for health sanity? No, of course not. Depression is, as I mentioned, is a silent killer. It doesn't kill you directly, but it induces suicidal thoughts, and a lot of people eventually commit suicide. So yeah, it's good to see a lot of people around the world, and welcome all, and thank you so much for joining us today. So depression, yeah, as Dr. Hardik brilliantly said, that it's you, when you go through it, you don't realize that what is happening to you, why you're feeling that. Depression is actually a state of prolonged sadness. Like we all do, we all feel sadness, and it's a natural emotion. But when it goes beyond our control, and it also coupled with feeling of worthlessness and loss of interest in activities, so there's a chance that you may be getting into the depression. Depression, like if you defined as per clinical terms, it's a common serious mood disorder. Those who suffer from depression experience persistent feeling of sadness. It doesn't, like when they feel the sadness, it doesn't go away. Usually, normally we may have some sad moment, some happy moment. So it, like, moments do not persistently be with us. So, like, but when you feel the feeling of hopelessness, loss of interest in activities, and as per the DSM-5, that is like, the as like for psychologists, like when we cure patients, or when we treat patient, if we take to identify, when we have to diagnose the patient, so like these sadness and feeling of worthlessness and loss of interest, if the feeling is lasting for more than 2 weeks, then definitely you should consult a psychologist or a consultant. You need to seek some professional help, because if, like, mood cannot persist for more than like 2 weeks. So if you are feeling the loss of interest in all the activities, and you're feeling sad throughout consistently for 2 weeks, it's too much. You should definitely contact professional help, or someone who can help you. You need to talk to your parents or something. So this is how it is. So, like, as like when you as you said that when you talk to your parents, how was their reaction? Did they guide you, or did they say, okay, okay, it's a normal thing and it can go away or something like this.
See, what I have observed, not in my case, but with everyone, that
Yeah,
for parents, it is one of the most difficult things to accept that
yeah,
their child might have some issues like
yeah,
depression. Okay.
yeah,
So at first, they were a little bit worried, and yes, I mean, like every parent, they were trying to convince me that there's nothing to worry about, there's nothing to sad about.
yeah,
I mean, we have everything, and we should be grateful to God.
yeah,
And I was, though I was in that stage, but I was able to understand their concern.
yeah.
Um, but they did not stop there.
Mm,
Uh, my father took me to the physician. I still remember for the very
mm,
first time, and he asked me a couple of questions, and then uh, he suggested my father that I am giving him some medication, and if he doesn't feel well after a week,
mm,
then you must visit a psychiatrist.
yeah,
And after a week, the situation was not that good. So I told my father that yes, I need some help. I believe that. So then he took me to the first psychiatrist, and
okay.
yeah, I mean, uh, I I am grateful to the Almighty that I have parents, though they are not, very or highly educated, but
Yeah, but
yes,
yeah,
they understood
yeah, yeah.
that we
It,
need to deal with this,
yeah.
in a different way.
Yeah,
Yes,
that's how it's, I think the parental instinct are, when they don't need to be educated, but the thing is they know
yes,
that the child is suffering. And as Vijay is saying that depression is really hard to explain. It goes absolutely, when I was taking my like classes, when my psychology professor says that depression is hard to define, and if you can say, I mean, she defines it in a way that it's like when you are watching or you're seeing the world without the color. It's something that the colors take out, so there's no fun in life, there's nothing left in life to enjoy. So this,
absolutely,
even I have been through severe depressive episodes in my life as well, and I like, but the only thing is it can trigger, like in your case, like OCD was there, obsessive compulsive disorder, like then people needs to have the strong urge to do anything, and that could be linked to like cleanliness or anything. But the thing is that could be the, maybe this thing that maybe people get this idea, or maybe they need to seek some perfection or something. But the thing is, anything can trigger depression. There's no, I mean,
yes,
there is a myth that a person can go into depression after certain loss or something. No, there is like that.
no,
It can trigger a single or very non-relevant event in your life. Could be you may just something want to may anything, like maybe you fail exam, or even you didn't get the good grades as per your expectation, not by others. Maybe like people were saying that okay, you are a good person, you are doing good, but you may think that you haven't performed well. So any event that may seem very very tiny or irrelevant, but it can cause a depression. So you should never.
I would,
Yeah, yeah,
I would like to add. Sorry to
yeah. No,
interrupt you,
no, no.
but
It's okay. Yes.
I would like to make one thing very clear,
Yeah,
that I mean, there is no particular reason for having depression, right?
yeah,
I mean, if you say, like, usually people believe that if they make loss in their business, or they fail in the
yeah.
exam, or
It's not like
they
this.
they are like having breakup.
Yeah, any
But
issues? Yeah, no.
understand, there are plenty of celebrities who
Yes,
are suffering from depression, though they have everything: name,
exactly,
fame,
exactly,
facilities. Recently,
absolutely.
there was an incident in French Open when Japanese tennis player Naomi Osaka.
Yeah.
She
Yeah,
withdrawn
she has to.
herself.
Yeah,
She was one of the strongest contenders of winning
very
French
true.
Open, but she
Yeah,
was suffering. That's
exactly.
it.
And she took out.
So
Absolutely. Yes.
yes,
So that's how somebody is asking the how the is depression is related to medical consultant. No, actually, it's not. That's the reason why we are trying to create awareness. Like when you are suffering from depression or something, you don't need to go to your physician or to the doctor. You need to consult a psychologist or a psychiatrist, ideally a
yes,
psychologist, because with the therapy you can actually gain better understanding of what's going on. Because when you go to the psychiatrist, they are actually, again, they can prescribe you medicine which is not the right way to deal with such mental.
exactly,
But of course there are hormonal issues, and they could be due to genetic reason or due to some hormonal imbalances, which you may need some drugs. But the best way is to deal with all these issues through therapies, through, when you try to dig down what's going on, what's troubling you inside, from inside. So as Dr. Hardik very clearly said, that it's not linked to any person at due to loss or any job, because all these celebrities even face this depression. So it can happen to anyone at any time, and don't be afraid and don't be shy to say that you are you want to take some help, professional help, or from your friend. So it is something very common as you face the problem physically. Like you, if you have some headache or fever, you go to your physician. It's the same thing, that if you feel if you face depression, go to psychiatrist, psychologist. There's no harm in that. There is no guilt or there's no shame linked to this. It's just as like normal as going to any physician or psychologist. So, okay, let's come to the symptoms of depression, because it is very important to actually figure out before it hits you. So, I will just brief you that as per the DSM 5 outline, because this is how we actually diagnose a patient or a person that who is going through the depression or not. So depressed mood is all like you remain, for example, these are the symptoms I'm going to tell you, that then you can see that if you are suffering from that, then that means that you need to take action. So first is like when you are depressed, or when you are having a depression, that then your mood is actually remain sad throughout the days, for weeks, for days. It's like you don't feel happy in between, and there's a markedly diminished interest or the loss of pleasure in almost all the activities. Like you feel like you're just a couch potato on the, like, sitting on the sofa or on the bed. You don't feel like getting up or doing anything. Then there is a person, and you may feel some changes in your physical thing. Like maybe you may start to lose weight, or you may start to gain weight. So they could be, or maybe like they could be an increase in appetite or the loss of, because I've seen that a lot of people who are suffering from depression, they either start eating or they stop eating. In my case, I stop eating, but I've seen a lot of people that they start eating a lot.
overeating.
Yeah,
Yeah,
it's because they think that they need to actually, because they feel that there's something missing. So they, how to actually fill that missing part, they start eating. Then there's a slowing down of the thought, reduction of the physical movement or something. There's constant fatigue or loss of energy. There's another very important thing is like the feeling of worthlessness. There is like, this is the constant feeling that underlies in everything. Like you feel that you are worthless and you don't have anything to do in this world. And then they actually, then it leads to the suicidal thoughts. There's a constant recurrent thoughts of suicides there in the depression. You feel, because you feel that you're worth no more, so that means that you need to actually get out from this world. So it's not, and I would say that suicide is not a solution. This is the temporary permanent solution to a temporary problem. this is like this the problem that can be solved. So these are the thoughts, these are the things that if you are facing, you must take care of it. You must feel that now it's the time to take action. So Dr. Hardik, did you also have this suicidal thoughts or something, or what symptoms you felt? Because that the which you felt that the most overpowering. Because it's not. I mean, the symptoms that I actually shared, like some people
Yeah.
feel something more or something less.
Yeah.
So what were like
Uh,
your experience in that?
See, it depends on person to person. As you
Yeah,
in
yeah,
my case, like one plus one, like buy one get one free. So when someone is suffering from OCD, he is having depressive phases because of the seriousness of the illness.
yeah.
uh, I had several symptoms, I can say that. I also had reduced intake of food,
Mm-hmm.
and I was not feeling like to eat.
Yeah,
Another thing is I was sleeping more, not
yeah. It
less.
happened.
So
Yeah,
that was one of the prime symptoms.
symptoms. Yeah.
Additionally, I can say that I was not able to focus on my day-to-day
Yeah,
activities.
yeah,
So it's like you feel restlessness, though you are resting all the day,
yeah.
right?
But you feel
And
loss of energy. Yeah, true.
yes, and you, I mean, like in my case, I can say that I was having that kind of. I did not have suicidal thoughts
Mm-hmm.
for a longer period of time, but
Mm-hmm.
yes, there was a time in my life, that I had that kind of thought. But then, fortunately, I can say that I was able to think that
Yeah,
this is not the solution, and
yeah,
even if I do
definitely.
this, what what message will go to the society, especially.
Yeah,
And even if we don't care about society, then I should care about my family, like the
of
parents who
course.
have
Yeah,
like who have raised me for like 25 years, and I'm
yeah,
doing this. No, it is not advisable. Yeah.
yeah. Very
So
true.
it was
Very true.
there, but fortunately, I could beat those thoughts.
Yeah, yeah.
Yes,
That's
that I
that's
cannot
good.
do this.
Yeah,
Yes.
actually, yeah, that's the realization is very important. That's what I mean. The entire point of having this conversation here also, to make people realize that when you go through these thoughts, when you go through these problems, you need to realize that there is something needs to be taken care of. It's just like when you have the
True.
headache, you take a pill. So it's like just like when you have these feelings, don't ignore this, try to take some action. Because the thing is, as Dr. Hardik also said, that when you feel that there's something going on, you need to take some action. You need to come out from that phase. So you need to plan a strategy. Even when I provide some counseling to my I mean, I provide counseling to voluntarily to a lot of people, and I've met a lot of people who are suffering from this depression. And the only thing, even when I recall my depressive episode, there's no one can actually pull you out unless you take the courage to actually pull yourself out from it. And you need to do this, like if you don't feel like during the depressive episodes, when you are having depression, no, I mean, you don't feel like actually going to the world again. You don't feel like meeting with the people. You feel that you have lost everything. So you need to stop this thinking. First of all, you said, okay, now enough of it. You need to come out from it. Then go out. If don't withdraw from life. Like for example, I was providing counseling to to the person, and then she was saying that she doesn't want to even talk to the friend. And then I said, no, you have to make a point. You have to make a routine. You have to stay in touch with the life, because the moment you start disconnecting, that means that is the point that you get goes deeper and deeper in the depression. Because I think depression is a bottomless pit. Once you are stuck in that, you just go deeper and deeper. You just need to pull yourself out. You have to be
Absolutely.
more active. And the one thing, because when I was providing counseling to that person, she was saying that, as I said, that she was feeling so worthless. She said, I think that I don't belong this to this world. And she said, okay, that happens. So you need to then you need to find out your reason why. Face your fears. Okay, the thing is that I recommended, I suggested her that, start journaling your thoughts. And then when she came up to me, she said, actually there were not too many thoughts. There were only 2 3 thoughts. And then she said, okay, I don't
Yeah.
belong to this world, I'm worth it. And I said, okay, that's the main point, that the only 2 3 thoughts, these negative thoughts keep on coming and make us feel that, we are worthless. So I told her that, okay, these are the negative thoughts. Now you should focus on the positive one. Slightly, slowly, gradually. It won't happen in a day, or in just in few minutes. It will take time. You need to train your mind to see the positivity. Start, living in the moment. They say, okay, look, enjoy the moment around you, and pay gratitude to the simple thing that you have, like when you you have a family, you have a house, or whatever, like small things. Maybe you're just breathing. This is life itself is a great blessing. God has given us to actually experience this world with all our senses. So do it, live it. Try to the other important thing is that, we also, as Dr. Hardik said, even I face it, we either have the loss of appetite or the increase in appetite. So you need to control everything. You need to have a check. And here comes the important thing is, like, it's not only when you are actually facing depression, but actually you need to have a check on your thoughts, on your lifestyle every day. That's how you deal with your mental fitness. Because you can flow to any place, like, if there's a wind, and then you can go in the flow. it the wind can take you to that direction. So you need to keep a check on your thoughts all the time. So have a routine. Keep a check on your thoughts, that where are your thoughts are leading you towards, and identify it earlier, because that's the only way. The thing is, when you feel any of these symptoms, you have to just sort of ring a bell, that okay, this is something, have this alarm, that you need to take action of this. So I think, any questions? Let's see that if our audience have, because like we have covered all the symptoms and the strategies. So I think Sanity has some questions, quite much. If not, this always go to psychiatrist. Yes, Seema, of course we need to. Whenever you have some problem, don't be shy to seek help from your friend, from your colleague, from like even professionally. Yes, Zamakchari is saying that is a silent killer. Yes, because it attacks us and we don't know what's going on. The best treatment come only from the friend to whom you trust. In my opinion, if someone in depression, we have find his friend to. Yeah, but the thing is, sometimes friends also don't know what's going on. So yes, then we need to find professional help. Yeah. Yes.
Actually, I would like to talk about what I have done. I mean, like,
Yeah,
it
yeah,
was not
definitely.
conscious decisions at that particular time, but yes, I mean, first and foremost, like, if I talk about myself, first thing is visit a professional.
Yes.
Second, accept, because acceptance will come only, like,
Yes.
for example, once you are diagnosed with a particular illness or disorder, the
Hmm.
second major important step is to accept that,
Yes.
yes, I am going through this phase and there is nothing wrong
Absolutely.
with it.
Absolutely.
Okay, because what I feel is, like, unless and until, if we do not accept, anything in life, I'm not talking
Yeah.
about this depression or, we
Mm.
will not have the mindset of solving that particular situation or to
Very true.
overcome that particular situation. So so second is accept.
Yeah.
Third is trust your therapist or
Yes.
trust your psychiatrist. Okay, because this has happened, and I am pretty sure that you might have faced this, Ambreen, that
Yeah.
when we are having any mental health issues, there will be a time that we question on the therapist also, that
Yes. Yes.
maybe that guy is not proper for me,
Very true.
right?
Very true.
This happens to everyone, so trust.
Mhm.
And fourth step is like whatever assignments your therapist is giving, because
Yeah.
the best way to overcome any mental health issue is combination of professional help, medication, and counseling, especially
Very
the cognitive behavior therapy or ERP. There are several therapies nowadays. So we need to do this. And the last but the most important is find at least someone, at least
true.
one person in your life. He or she can be anyone:
Yeah.
parents, friends, your
Yeah.
partner, your
Yeah.
colleague, or a
Yeah.
coach, anyone with
Yeah.
whom you can share anything and everything
Yeah. Yeah.
without having the feeling of being judged.
Yeah. Very true. Very
Because
great advice.
if we find that one person, it will be, I'm not saying that it will be an easy journey, but
Yeah.
yes, it will be a kind of easy journey than,
Yes.
you are riding alone. If I
Yeah.
talk about myself, I would like to express my sincere gratitude to my aunt.
Mm.
Yeah, in fact, I can say that if I'm living and talking to you, it's
Yeah.
just because of her. Yeah.
Oh, yeah. Totally.
Yes, she was
Yeah.
like,
Very
she
true.
is a school principal, but she
Mhm.
is like my 24/7 psychiatrist or psychologist, whatever you want to
Yeah.
say.
That's very
Because
true.
there are
Great
some things,
advice.
yeah,
Yeah.
yeah, there are some things where, like, you cannot share everything with your parents or with your brother or
Very true.
sister
Very
or,
true.
like your partner. So find that someone
Yeah. Yeah.
and
Very
try
true.
to be that someone for
Absolutely, for
whom,
others also.
yes, for
Absolutely. This
others.
is a very important message. I think this is the main thing, that be the one to help out others, to bring the smile on
Yes.
someone's face. I mean,
And
don't
on
judge others. Yeah.
and on that note, I have started this Thumbs Up Foundation,
Yeah.
where I put my best efforts to help someone who is suffering
Yeah. Very true.
without charging a single penny.
That's
That
that's
is
a
the main goal
yeah.
of mine, because I
That's a
believe
great
that
machine.
if
Yeah.
God, if God has given me this second life, I need to do something for the society.
Absolutely. That's
That's it.
such a noble cause, and I'm so proud of you. I mean, seriously, that's a great cause. And
Thank you.
the same thing, like literally, I've been doing it, like helping people and providing counseling out, like for no good cause, without a
Yeah.
single penny, because my profession is marketing research. I'm a like marketing
Yes.
person, completely different from. But yes, I know that I'm a psychologist. I have learned and I've been through this, so I feel that why not help out people, to reach out to them, because they need a little push in their life, a little push, a
Exactly.
little two words of encouragement, and their life changes. I've seen it happening. People are suffering at one point and they need just two words of encouragement and they feel alive. So
Absolutely.
let's eliminate this. Somebody is asking that what's the difference between depression and stress. Depression is the feeling of sadness. Stress is like when you feel some pressure on you, that you need to excel something, you need to deliver something on the time or something. So that is the stress. It's a basically a reaction towards, sort of a threat. When you feel stress is something that it's a natural response when your body is feeling some threatened by something. So that is how you feel stress. Depression is a sadness. It's completely different. It is a loss of interest in every activity, and an extreme form of sadness. And Krusta is saying that in USA, doctors do not, of course, they don't prescribe medicine, but in certain cases, like for example, postpartum depression. So it's basically that happens because of the hormonal changes. So then they need to prescribe some medicine. But of course, medicines are not is not a good way to actually treat mental illness because it there are lots of side effects and it makes you sort of there are, I would just say that lots of side effects to it. Yeah. Yeah, yeah,
Yes.
sure, sure.
On the contrary, I would like to say that, of course, medicines only medicine is not a
Exactly.
solution. But on the contrary, I would like to say that take medicine if it is required. Okay,
Yeah, of
I'm not
course.
I'm not promoting medicines
Yeah, yeah. But
because there
in
are some
certain
issues.
cases are needed. It is needed. Definitely. That's what I'm
Yes.
saying. That's a,
Yeah.
because
It's
there
like
are lots
if
of
you need
cases.
surgery, then you need to go for surgery. You cannot
Absolutely.
do it with the
Absolutely.
help of pill, right?
Exactly.
So if the psychiatrist is suggesting something,
Yeah,
you should do it. Yeah.
exactly, exactly. Because there are, that's what I actually said, that, there are lots of hormonal issues as well that needs to
Yes.
be actually tackled. So in that case, you need to happen. So, okay, I think we've reached to the end of our show, and let's wait for 2, 3 minutes. If anybody has any question, please ask before we actually close this session. So let's wait for, as in the meantime, any, like you have already suggested and you've given advice, but any one single advice that you want to give any, like, to the audience, that they need to take care of themselves, that, or to,
Yes.
the way that they need to deal with depression or something, any advice, single words or something.
Yes, I would like to share a couple of sentences, and
Yeah.
that mental illness is real.
Yeah.
Consider it like a physical illness or
Absolutely.
disorder. I mean, like, because usually we have this tendency, if we have anything, like fever or cold or any other issue, we immediately go to the doctor, right? But same thing is not happening when we are suffering from some disturbance, mental disturbance. Okay,
Yeah.
so don't neglect it.
Yeah.
Don't feel shy. Don't feel sad or don't feel bad for mental health issue. It's fine.
Yeah.
Okay, and the last thing is that it is possible to live a healthy life even
Yes.
after
Yes.
suffering from any mental issue, right?
Absolutely.
It's like,
Ab-
it's simple.
Yeah. Yeah.
If someone has diabetes or blood pressure,
Yeah.
right, it is possible to control that,
Yeah.
by taking proactive measures. Similarly, there are issues like depression or OCD where
Yeah.
we need to take precautions and proactive measures. Yes,
Yeah.
so it
Yeah.
is possible.
Very good. Absolutely, completely agree with you that a lot of time people lose hope and they say that it's not possible to, and that's the reason why they actually end their life when they feel that there is no hope of, having a better future or leading a better life. So yes,
Yes.
I think, like somebody's asking about the stress. I think it's stress we'll take care of in other episode. So I think it's time to say goodbye. And thanks everyone for joining today. And I hope our discussion helps you. And it was helpful and insightful. And thank you, Doctor, for joining us and enlightening us with your insightful views and opinion and discussion and sharing your journey about your how you came overcame with the depression and your mission. Thumbs up, which is definitely an incredible mission. Thanks a lot, and let's say
My
goodbye to
pleasure.
the audience. Thank you.
My
And
pleasure. And thank
okay.
you so much, audience, for being, like
Yeah.
having amazing participation. And thank you, Ambreen, for inviting me on this platform.
Thank you so much. Thank you. Okay, bye bye.